The particular test we want to look at now is one that tries to detect antigen in a sample. This particular example is the respiratory syncytial virus antigen test. This is performed on a nasal pharyngeal swab or nasal aspirate from the patient, and the procedure is somehow capturing that antigen and detecting it using a impregnated membrane. The membrane comes in this little kit. This is the little kit we have right here. For some of the details, when it comes to doing the lab report, you can look into this particular methodology that's listed here. What we'll do in this case is we will take our specimen, our swab, we will add it to some diluent. That diluent will allow us to create a suspension of the specimen. That specimen then can be utilized to determine whether or not we have antigen for this particular virus. So of course it's going to be captured, at least in part, with some kind of antibody. We have a little pad that also has some antibody components mixed in. We're going to take our sample, our first sample. The swab has been mixed. Take that first sample, going to add it to our pad. I'm going to close our pad while the reaction by capillary action occurs. We'll have a second sample. That second sample has been sitting as well with a swab from our patient. We've caused the antigen to go into solution. If it's present, the antigen being the virus, we're going to take that specimen, add it, to our sample area, and now we'll create this closed area with our window, and we'll let this incubate and try to determine whether or not our patients have antibody, antigen reactions. Right now the movement is occurring down through the sample. We can see that the control is starting to turn positive on this particular sample. This right-handed one, control control is not appearing yet. These need to sit and incubate, so we will allow them to sit and incubate. And then we'll come back and take a look at the result. But you can see the control is coming up on the left. It appears to be coming up on the right. I will turn the equipment off and we will look at it in roughly 15 minutes.